I'm going to show you a tool which is called responsible personnel. You have to know that in a dental clinic, not everyone should get access to every part of the program. So because of that, you have the owner, which has full access everywhere. You have the practitioners who have access to their patients and the finance of their patients. And you have also people working in the clinic, like the accountant, like the manager, like the assistant, like the secretary, and each of them, they have different kind of access. To find that, you go to settings and you go to personals. And in personal, you will have the list of the people who are working in your clinic, like Laurence Jenny. I open Laurence, I have a picture, I have her name, she's an assistant, and she has an email address. She can log in with her email address, and she has access to all these things. This means that she has access to the patient chart, the card. The payment is excluded because the secretary will take care of that. She has access to the history, to the medical questionnaire, to the chief complaint, in case she's going to ask the patient to answer a certain number of questions, we will give access to that. She will not have access to the income, to the pending payment. We will manage that with the secretary. And the clinic report is showing all the details of the income of all the dentists working in the clinic. And by default, she would not have access because she's logged in with a practitioner. Her name is Joelle Erica. But in some cases, if she has an access to Bessie Liz, who is the owner, we can give access to her in the income, in the annual incomes, in the pending payments, etc. But if she has no access to Bessie Liz, then it's impossible to tick this. Based on this, we update the personnel and we are going to log in as the personnel, responsible personnel in that clinic. So we click on that. She logs in like this. And now she has her personal access with the diary for Erica only. With the utility, she has access to the diary. She can make modification. She can have access to the contact, to the tutorial and all that. And this is enough for her to work in a good way with the patients and help the practitioner to enter this. So for the management of that, you will have to register for the responsible personnel. To make the settings for each of them, you can modify the settings when you want, and this will be approved by AccuDent with a license agreement on a 1-year period, yearly or monthly paid. Thank you for your attention.